You're all set, Mr. Chair.
Okay, good evening and welcome to the March 4th, 2022 impromptu meeting of the Needham Board of Health. I'm Rob Partridge, Chair. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of 3/12/2020 and as amended on June 15th, 2021 due to the COVID-19 pandemic. The materials for this meeting have been circulated previously and are available on the town website. This meeting is being recorded. I will introduce each board member. Please respond by saying yes when your name is called. Kathleen Brown.
Yes.
Steve Epstein. Steve, you're muted, I think.
I am, yes.
And Ed Cosgrove.
Yes.
And Christina won't be joining us, at least initially, and possibly not for the whole meeting. So we can move forward as we have a quorum with a COVID-19 update. Tim, do you want to discuss that briefly, or Tara?
Sure, we do have Julie the Epi, and I was going to let her give a brief overview of the COVID
Oh, sure.
data.
I did not realize Julie was here.
Yep. So Julie, if you want to take it away, I'll go through.
Oh, you're going to go through it? Okay.
If you could go through it, I'll click through when you tell me to.
Okay. Yeah, you can go to the next slide. Okay. So Needham's percent positivity is continuing to decrease, which is good. You know, a little slower now in the past few weeks as the percent positivity is getting lower. The daily incidence rate and the percent positivity also continues to decline statewide, and for the cities and towns around Needham. It looks like Newton had a slight increase in their percent positivity from last week, but overall they're dropping. As this chart has changed, I just want to note that Newton did drop their indoor mask mandate on February 18th, and Boston dropped their proof of vaccine also on February 18th, and their indoor mask mandate is set to end tomorrow. Next slide. As we're looking at the percent positivity, I just wanted to note that the number of tests actually being administered, the number of official tests, is decreasing as well. So during the peak of Omicron, there were about 6,600 tests in a 2-week period being administered for Needham. And now we're down to about 3,000. Next slide. The cases continue to decline, and now we're at a 7-day average of less than we were in the weeks prior to Omicron, and I think closer to where we were in the late summer. So we're around 3. Obviously, this fluctuates, but we're around 3 or 4 as a 7-day average. Next slide. In the past 2 weeks, we had 61 cases. 13 of those were in school-age children, and the average age was 35, which is just slightly higher than it has been the last few times I've done this. Next slide. The vaccination and booster rate seem to be kind of at a standstill, I would say. So, you know, we're still at greater than 95% fully vaccinated, which is great, and 64% have received booster doses, which I think has remained the same the last few times I've compiled this data, and especially in the age groups who have been eligible for quite some time. I haven't really seen much movement there in terms of percent of those populations who've received a booster dose. Next slide, or next 2 slides. Yeah. I just wanted to talk briefly about Ba2. So Ba2, a sublineage of Omicron, has been increasing relative to Ba1 recently, but global circulation and cases globally are still declining. I've seen a lot of headlines that show Ba2 may be more severe than Ba1, but from what I can find, this is from preliminary lab data from Japan using hamsters that don't have immunity to SARS-CoV-2, but I am seeing in a more real world context that data from South Africa, the UK, and Denmark was showing that there isn't a difference, there doesn't appear to be a difference between BA2 and BA1 in terms of severity. And notably, those are in places that have high vaccination rates, which Massachusetts would certainly qualify as. In the US, BA2 is 8.3% of COVID cases. It's supposed to say as of 2/26. And in the Northeast, it's actually notably higher at 19.1% of cases. Needham has had 2 sequence samples that I can see so far, which were BA2, and those were at the beginning of February. There's obviously quite a lag in sequencing data, so I will keep an eye on that. Next slide. The CDC, as we know, recently updated their mask guidance. So previously, Norfolk County fell under high community level transmission. But with this new guidance, Norfolk County and many others throughout the country now fall under low community level transmission. And this is sort of a shift on the CDC's part, moving to different metrics using things like new COVID admissions per 100K and percent of staffed inpatient beds occupied by COVID-19 patients. They also decided to not require that people wear masks on buses or vans operated by public or private school systems. And this was to fall in line with this updated guidance that no longer recommends universal masking in education settings where your community falls into low or medium transmission. Next slide. This is just, again, showing that statewide, the daily new cases continues to decrease. You know, at the peak of Omicron, we were around 23,000 cases a day, and we're down to 600 or so. And the percent positivity has dropped from about 23% at the peak to about 1.8%, which is great. Next slide. If you break the new confirmed cases down by age group, so the first column is the current reporting period, then the previous reporting period, and then the reporting period for about a year ago. And for once, I think since I've given these presentations, the cases for 19 and under in the current reporting period actually add up to less than the cases a year ago, which is nice to see. And I think overall in each age bracket, we are at less cases than we were a year ago. I think that there's, some question about the accuracy of some of these metrics and whether the decrease in cases and percent positivity is due to a decline in official PCR tests because people are opting for at-home antigen tests. But just as we used the wastewater RNA signal as an indicator of, the approaching Omicron peak, we should also use it as an indicator of us coming down from the peak, and the wastewater RNA signal continues to decline. And I think that this will be a good metric for us to go by as we continue on. Next slide. Looking at the hospitalization rates, again, current reporting period, then previous reporting period, and then the last column is a year ago. Between last reporting period and current reporting period, the hospitalization rates continue to decrease. And overall, for quite a few of the age brackets, we're finally seeing the hospitalization rates fall below what they were a year ago, especially in the older categories, not so much in the younger categories. We're sort of hitting roughly even. But the caveat is the next slide, which is that we know 61% of the patients currently hospitalized for COVID-19 are actually incidental COVID-19 cases, which means they came in and tested positive upon admission, but were not there due to the COVID. So only 149 out of the 383 currently hospitalized for COVID were actually admitted due to COVID-19. And that's it. That was speedy, but if anyone has any questions, let me know.
Thank you, Julie.
Thank you. Does anybody have any questions for Julie? Well, we certainly have a lot of information that the incidence rate, hospitalization rate is declining significantly. I'll also point out that I think Wellesley lifted their mask requirement for municipal buildings either today or yesterday. That will be effective March 7th. In addition to the other towns that Julie mentioned.
Right. And the schools, the Needham Public Schools are going mask friendly, which is a mask optional policy effective Monday, March 7th, for everything except their pre-K program, which I think they would anticipate, at least right now, I think they're anticipating that that would go mask friendly a week or two after. Right now, the board has in place an emergency order requiring the use of face coverings in buildings that where sort of at-risk groups tend to congregate. So youth, seniors, so the library, the senior center, the park and rec programs, wherever they occur. Right now, that is still in effect. And the board does not have a sort of a sunset provision in its emergency order. So it can choose to sustain that, can choose to modify that, can choose to rescind it. But that was sort of the purpose of the meeting, was to provide the board with information on the current state of COVID and let the board decide if it wishes to modify its emergency order regarding face coverings.
Steve, you're muted again.
Just to clarify, this is to rescind the emergency order only for the requirement in your municipal buildings, correct?
Right now, that's the only requirement that we have in place for the Board of Health.
Got it. We still have an advisory in place, however, strongly recommending the use of masks in indoor settings, correct?
Especially for people in high-risk groups or people who are vulnerable or people who haven't been boosted yet.
Mm-hmm. Okay. So to move this along,
Yeah.
I'll make a motion that we rescind the emergency order.
I'll second.
Okay. So is there any other discussion on that?
Tim,
Okay.
we have an adequate amount of masks for those who requesting them at the Center for the Heights, right? I mean, I think that was one of the things that we had discussed earlier.
We do. We bought, I forget if it was 2,500 or I think it would have been 2,500 KN95s and 2,500 surgical masks. We've distributed boxes of surgical masks to the library and the Center at the Heights, and distributed KN95s for staff in all town departments, regardless of DPW, town manager, all throughout town. Mm-hmm. And we have some extra that we've kept in reserve. We also have started distributing. The town ordered some town and the schools ordered COVID-19 at-home test kits, and we ordered a few hundred extra. And so we have those, and we have actually, I believe, Tiffany, maybe it's yesterday or today, you or your team started distributing them to the Housing Authority residents who were interested.
Yes, once they finish moving to their new building, they will have them because they are moving offices. So soon.
Great, thank you.
Okay, so I think we can vote on the motion. And I guess I'll call people out by name. Kathleen Brown,
Yes.
Steve Epstein,
Yes.
Ed Cosgrove. You're muted.
Yes.
Okay, and Rob is also yes. So the motion passes, and the mask requirement for the municipal buildings is rescinded. So Tim, just looking over the data that was presented.
Yes.
When we put out the communication about this, in addition to our advisory for people to continue to mask or to continue masks who have either health problems that would make them more at risk or immunocompromised, I think we really do need to emphasize that people need to get boosted, because we don't seem to be moving on that at all. And a lot of those people are going to be vulnerable if they don't get boosted.
Absolutely.
I think it's just a good opportunity to say it.
Certainly, it's a good opportunity to remind people. I do think the one thing we had seen, maybe not last week to this week, but over the last 4 or 5 weeks, we have seen the percentage of 5 to 11-year-olds who are fully vaccinated tick up. It had been in the mid to upper 80s, and now it's in the low 90s. So
Can you
that
clarify
is
between fully vaccinated and vaccinations up to date, although I don't
So
think
for
they're eligible for boosters yet or not.
the 5 to 11-year-old segment is not. There's 3 that have been, which I'm assuming means their doctor has sort of given them special permission because they might be in a very particular situation with maybe under cancer treatment, for example. So that group has the fully vaccinated 2-shot regimen has moved up from, I think it was the high 80s to 91%. But as Julie mentioned, the fully vaccinated and boosted, so who had 3 shots generally, have largely they've been moving up by 1 or 2 a week, not 1 or 2 percentage points, 1 or 2 people a week. So they've been basically flat for weeks now. We can certainly take this opportunity when we announce the rescinding of the mask mandate to highlight the importance of people getting boosted. We do think that we're constantly looking for people who want to get vaccinated. The interest has ebbed and flowed, and right now it's at a low point, I think, which is unfortunate.
Can I ask, even for the older adults, like that, we're in like the 80%, right, for boosted? Is that correct? Because they're really the ones who need it. I mean, I know it's recommended for everyone, but like, do we know who we're missing there, or probably not?
It certainly would be helpful if we knew exactly who we were missing.
Yeah.
Let's see if I.
Yeah, I mean, when we go back to that slide, yeah, there you go. So over 30, we're basically at 80% plus.
Yep.
Which is good, but for those older folks, I mean, it's been a long time, right, since their shots. Yeah.
Might reach out to the nursing homes. I'm wondering if some of that is where this is coming from, or if they're all 100% because they wouldn't hopefully be encouraging it.
Yeah.
We certainly can do that. Absolutely.
Can I just ask one other question? So for employees who are very worried, I mean, the reason we put this mask mandate in is because there were people who were concerned about their exposures, and we're giving out KN95s. We've avoided N95s because you need a respiratory protection program, right? If you give those to your employees, yet they're being handed out in CVS to anybody that wants them. At least I don't know about our CVS, but how does that work with the state? Are they just overriding the NIOSH guidelines and without having people like medically cleared wearing N95s around town?
So the N95s that we gave out are the ones you can buy at Home Depot. They're not the medically approved by the FDA N95s.
You mean KN95s or like the three?
No, the N95s that you would wear when you're painting or sanding. Those are the N95s that we bought that we have been giving.
Yeah,
you can
but
buy
it
those
says right
Home
on
Depot.
the package, you need to be, this is part of a respiratory protection program, like
These ones are not
here's the weird
medically
thing.
approved. These ones are not medically approved. So these aren't the same ones that they use in the hospital.
Right.
So they only say on the box that they will protect from the effects of what the sanding or process is. I can't remember the exact words it says on it, but something towards that effect. They don't say anything medically that this will protect against medical viruses or anything like that. So those are the ones that we gave out as far as that goes. I have not seen the state put out anything in regards to asking people to get fit tested, even though they do put out, same with the CDC, these are the best ones that work to this level, which one works best for you. But I have not seen either group put anything out specific towards you should get tested to wear these.
So we have people wearing this head strap behind the head, N95.
All
Right?
N95s, that's one of the features of any.
I know that. Yeah, right. But my understanding is if it's called an N95 and it meets the NIOSH guidelines, you're supposed to be in a respiratory protection program. But
I don't know against.
Okay.
I mean, the medically approved ones, yes. These ones are not medically approved, so I don't actually know that information.
Okay. Anyway, well, I just mean like if people want a better mask, they can get one, but there is a gray area there on whether you should just be having the general public wearing N95s around.
Sure, they're not going to do the best unless you actually know it's fitted correctly. So those people who are wearing them are hoping that it's working appropriately. My concern more is those who have a difficulty breathing already that wear
Right.
them.
Yeah.
Because
exactly.
it makes it worse. So
Yeah.
that's where my concern lies.
Right,
on
that's kind
that
of what I
aspect.
was getting at, like these people
Yeah.
are worried now they're wearing something that could be taxing, I don't know. But, okay,
Do we have any capacity in the health department to actually fit test people who want to be fit tested?
No, it requires a whole hood. They used to do it a long time before I came, but it requires a whole setup that we don't have.
Okay.
and at least a year ago, those systems were way back ordered, like we use them at work, to fit test people, but they were hard to find. I assume now you can find them again, but.
Yeah, to say nothing of how long it would take to do. I mean,
Yeah,
I've been trained as a fit tester, and
yeah.
processing all these people would be tough.
Although I do think it would be a small population would be interested, but you never know. Okay, I just wanted to follow it, for people who are concerned, to make sure they have a way to get something that works for them, that isn't going to cause a hazard. So,
Yep.
Cool. Thanks.
Okay. Do we have any other business this evening?
There is no other business scheduled. The board's regular sort of monthly meeting with monthly reports and review of minutes is scheduled actually for late in the month, the 29th. And then its meeting for April is scheduled for the 27th of April.
Okay. Oh, one quick thing about this order. When is it going to be effective?
So I don't know if we discussed that. To me, it would make sense to time it with the school's order, which again, is effective on March 7th, which is Monday morning, presumably.
Yeah, I think that's what Wellesley did.
Yeah, I agree with that.
Okay. No, I mean, it makes logistical sense. Okay. Great. Well, if
Well,
there's
thank you for
nothing
that.
else,
You'll need a
everybody have a
motion to
nice.
adjourn. Well, you need a
Yeah.
motion to adjourn, but then
So moved.
So moved.
Second.
Okay. All in favor?
Aye.
Aye.
And Kathleen, I.
Bob, aye. Have a good
Ed.
weekend, everyone. Thank you.
Thank
for
you.
All
attending
right, take care,
on a
guys.
Friday evening.
Bye-bye.
Bye.